Emblematic case of congenital adrenal hyperplasia obliges to consider an adequate civil gonadal recognition, REGOCI, and neonatal screening. A poster displayed at the European Society of Pediatric Endocrinologists in Greece 2018 by Silvia Cristina Chain, pediatric endocrinologist, and Federico Mejia, a lawyer from Colombia. Introduction. The National Registry of Civil Status, through Circular 33 of February 24, 2015, instructed the guidelines for the allocation of a sex through an inscription on the Civil Registry of Birth for intersexual minors. Objective: to create a clinical and medical awareness on the importance of making an accurate diagnosis of congenital adrenal hyperplasia in order to avoid adverse effects due to the omission of the due diligence by violating the pro-childhood rule. Methodology: if there is any clinical suspicion on patients with congenital adrenal hyperplasia, it is important to take into account the neonatal screening for 17-hydroxyprogesterone, accompanied by an adequate recognition of genital configuration on the newborn, REGOCI. This ensures compliance with the provisions of the aforementioned circular. Analysis: the absence of an adequate civil gonadal recognition generated the sanction of Circular 33 of February 24, 2015. This demonstrates that congenital adrenal hyperplasia demands an active, objective, and solidarity responsibility from the entire medical community. Result: the state authorized an additional intersexual inscription to the masculine or feminine gender for patients with congenital adrenal hyperplasia or similar. Conclusions: socialize the importance of teaching the clinical diagnosis in order to perform adequate gonadal recognition, as well as the urgent need to legislate the neonatal screening for 17-hydroxyprogesterone in cases related with congenital adrenal hyperplasia. Avoid adverse effects such as death, low stature, precocious puberty, mental deterioration, and gender dysphoria in congenital adrenal hyperplasia, where the patients are annotated in the sex not corresponding to their karyotype. We impact on human identity, name, nationality, capacity, and domicile of people born alive.